WentWest has been working with the Western Sydney community since 2002. This year reflects a long history of involvement with primary care and general practice, and indeed communities, consumers and other partnerships and organisations we have formed over a long period of time and have really strengthened in the last 12 months. Communities' needs are changing and we need to be able to respond to those needs in a way that's both structured and deliberate. WentWest, as the Western Sydney Primary Health Network, has been able to fully implement its commissioning responsibilities, commissioning around $18 million worth of funds into areas of need here in Western Sydney across a broad range, including Aboriginal health, alcohol, the drugs and mental health. We believe those funds being commissioned is beginning to have a very strong impact on the lives of people here in Western Sydney and the outcomes being achieved in health and human services. One of our partnerships, the Diabetes Initiative, which is a partnership with Diabetes New South Wales and the Western Sydney Local Health District, was earlier this year recognised as a significant partnership initiative by being awarded the Pemulwuy Prize here in Western Sydney. It's excellent recognition of some of the work we're doing regionally, but also having an impact on lives right across Western Sydney and New South Wales. The establishment of the Consumer Council 2 years ago as part of our Primary Health Network responsibilities was an important milestone in being able to ensure that consumers have a formal and deliberate connection with our primary health network and the things we do and the decisions we make.
The theory of actions speak louder than words has certainly been prominent in my work with WentWest this past year. In the last 12 months as a consumer advocate on the Consumer Advisory Council, I think we have worked really hard in building relationships and partnerships with some of the players in the health industry, like the Sydney Children's Hospital Network, the Consumers Health Forum, the Western Sydney Local Health District. Building those partnerships sets the platform for then moving forward to working together and really embedding consumer involvement into the development of a better health system.
Our continued work in improving the capacity and capability of primary care is reflected in our leadership of implementing the principles of the patient-centred medical home. Principles of the patient-centred medical home are reflected by good quality general practice, being accessible, continuous and coordinated around the person's needs at the primary care level.
Patient-centred medical home to me means that the patient is a person. You have to see the patient as a person known to you as their family doctor. See what was their need before, check if they need a new referral, check if you can involve services around, whether community services, whether a specialist, whether a allied health professional. This is what the patient needs, a coordinated approach.
General practice performing and primary care performing at the highest level is good for the system. And it's an investment we feel very, very strongly that we should continue to make.
I think WentWest is highly regarded and generally seen as a leader in Australia in terms of health system reform. I think that the federal government looks to WentWest, the state government looks to WentWest, and certainly the LHD, the local health district, works very happily with WentWest in system reform.
The Healthcare Homes program arose out of the federal government's review of primary health care in Australia. The review identified the need to strongly focus on the needs of consumers, particularly those with chronic and complex conditions, and look at models of care that can more effectively meet the changing needs of the Australian population, particularly in those areas. Well, we feel very positive about our impact in 2016 and 17. The progress we've made around commissioning, working with communities in partnership, and really having our actions speak louder than words is something we will take into future years as a primary health network and in partnership with consumers, communities and organisations here in Western Sydney and beyond. Our success wouldn't be possible without the strong leadership and vision setting by our board. I thank them for their support of the organisation and continued dedication to better health outcomes here in Western Sydney. I'd like to thank all of those who've worked with us over the last 12 months. It's important that we continue to work with you in partnership. Your efforts are incredibly important to ensuring better health outcomes in Western Sydney.
What matters to me is a healthcare system that has the highest standards, accessible, affordable, the one that can support my family whenever we need it.